What is a heart attack? The simple truth. Do you really know what a heart attack is? Most people think it's just when the heart stops working. But that's not exactly true. A heart attack is not a sudden failure, it's a slow, silent process that often builds up over years. Imagine the highways that carry blood to your heart as traffic lanes. Every heartbeat depends on clear passage. Over time, fat, cholesterol, and other substances start sticking to the inner walls of these arteries, forming plaque. At first, you might not feel anything. The flow continues, just a little slower. But one day, that plaque ruptures. The body senses an injury and sends platelets to repair it, but instead, they form a clot, a biological traffic jam that stops blood flow completely. When that happens, the part of your heart muscle that depends on that artery begins to suffocate. Within minutes, those cells start to die. This is what doctors call a myocardial infarction, or simply, a heart attack. The American Heart Association defines it as the death of heart muscle caused by prolonged lack of oxygen. And according to their data, someone in the United States has a heart attack every 40 seconds. That's more than 800,000 events a year, each one with a story, a family, and a race against time. What's even more shocking is that nearly half of those people never had warning chest pain before. They didn't see it coming. Some just felt fatigue, nausea, or shortness of breath. Others ignored mild pressure, thinking it was indigestion. And when the real attack hit, the clock started ticking. Time is muscle. Every minute without blood flow means more damage, more heart tissue lost, and a lower chance of survival. Understanding this process is not just for doctors. It's for anyone who wants to protect themselves and the people they love. Because when you understand what a heart attack is, you begin to realize it's not random, it's the result of choices, habits, and biology quietly at work inside you. In this video, we'll break down the simple truth about how a heart attack happens, how it differs from cardiac arrest, and what you can do when every second counts. Knowledge, in this case, isn't just power, it's survival. Inside your body, your heart never rests. It beats around 100.000 times every single day, pushing blood through a network of arteries that feed every muscle cell with oxygen. But the system isn't perfect. Over years of stress, poor diet, smoking, and high cholesterol, something dangerous begins to happen. Along the inner walls of your coronary arteries, tiny injuries form. The body tries to heal them, but instead of smooth tissue, it builds layers of fat, calcium, and dead cells. This mixture becomes what doctors call plaque, the foundation of a future heart attack. For a while, plaque may sit quietly, narrowing the vessel just a little. You can live years without noticing anything wrong. But deep inside, inflammation keeps weakening the thin fibrous cap that covers it. Then, one day, triggered by stress, a surge of adrenaline, or even while you're resting, that fragile cap cracks open. The bloodstream reacts instantly, sending platelets to patch the injury. But the body overreacts. Those platelets form a blood clot so big that it blocks the artery completely. In seconds, the heart's lifeline is cut off. Oxygen can no longer reach the section of heart muscle fed by that artery. Cells start to panic. Within 5 minutes, they lose energy. After 20 minutes, the muscle begins to die permanently. This is the critical point doctors call acute myocardial infarction. On an ECG, it often shows as a street segment elevation, a sign that heart tissue is in distress. The longer the blockage lasts, the more damage spreads outward. That's why cardiologists use the phrase, time is muscle. The sooner the artery is reopened, through a percutaneous coronary intervention, PCI, or fibrinolytic therapy, the greater the chance of survival. Without treatment, the heart can go into ventricular fibrillation, an electrical storm that leads to sudden cardiac arrest. But the story doesn't have to end that way. The buildup of plaque isn't destiny. It's a process influenced by the way we live, by what we eat, how we move, how we handle stress. The next time you hear about someone having a heart attack, remember this. It doesn't begin with pain in the chest, it begins years earlier. Quietly, inside your arteries. Understanding how a heart attack happens isn't just science, it's a reminder that the fight for your heart starts long before the emergency room. People often think a heart attack and a cardiac arrest are the same thing. But in reality, they are two completely different crises happening inside the body. A heart attack, or myocardial infarction, is a plumbing problem. It happens when the arteries that deliver blood to the heart become blocked by a blood clot or plaque rupture. Blood flow slows or stops, starving part of the heart muscle of oxygen. The heart is still beating, but struggling. You may feel chest pressure, pain spreading to the arm or jaw, or shortness of breath. In contrast, a cardiac arrest is an electrical problem. The heart's rhythm suddenly goes haywire. It starts quivering instead of pumping. This is called ventricular fibrillation. When that happens, blood stops moving altogether. Within seconds, the brain loses oxygen, and the person collapses, unresponsive and not breathing. Cardiac arrest is what causes sudden death if help doesn't arrive quickly. While they're different, one can lead to the other. A severe heart attack can damage the heart's electrical system, triggering cardiac arrest. That's why fast action during a heart attack isn't just about saving heart muscle. It can literally prevent the heart from stopping. In a cardiac arrest, the only immediate treatment is CPR and, if available, a defibrillator, AED, to shock the heart back into rhythm. Every minute without CPR lowers survival by about 10%. That's why public places like airports and malls now keep defibrillators accessible. They buy time until emergency services arrive. In a heart attack, on the other hand, CPR is rarely needed at first. What matters most is restoring blood flow. Emergency teams use angioplasty, stents, or clot-dissolving drugs to reopen the artery. So if someone clutches their chest but is still awake and breathing, it's likely a heart attack. Call emergency services immediately. If they suddenly collapse and don't respond, it's cardiac arrest. Start CPR right away. Understanding the difference isn't medical trivia, it's life-saving knowledge. Many lives are lost not because help wasn't possible, but because people didn't know which crisis they were facing. A heart attack gives you a small window of time to act. Cardiac arrest gives you seconds. Both are emergencies, but knowing what to do in each can mean the difference between tragedy and survival, between a life cut short and a heartbeat restored. Knowing what a heart attack is just the beginning, because knowledge alone doesn't save lives, action does. Once you understand how a heart attack happens and how quickly the heart can die without oxygen, you realize prevention isn't about fear. It's about empowerment. Every heartbeat you still have is a chance to protect it. The truth is, most heart attacks don't start in hospitals. They start in everyday life, in the kitchen, at the desk, in moments when stress feels normal. The foods you choose, the sleep you skip, the cigarettes you light, the walks you avoid. These choices slowly shape the fate of your arteries. But that also means you have power to change the story. Small steps like moving 30 minutes a day, eating more fiber and fewer trans fats, keeping blood pressure and cholesterol in check, and learning to manage stress are not just lifestyle tips, they're frontline defenses against heart disease. If you've already had a heart attack, your recovery doesn't end when you leave the hospital. It begins there. Cardiac rehabilitation, medication adherence, and emotional healing are all part of rebuilding a stronger heart. Millions of people live full, active lives after heart attacks because they understood this one truth. Prevention and recovery are two sides of the same heartbeat. So before you close this video, take one promise with you. The next time you feel chest discomfort, unexplained fatigue, or shortness of breath, don't wait. Call emergency services. Seconds matter. If you take one thing away from this, let it be this. You don't have to be a doctor to save a life. You just have to listen to your body and act fast. Because knowing what is a heart attack is just the first step. Recognizing its symptoms is what keeps you alive. If you haven't seen our previous video on heart attack symptoms, watch it next. It could be the most important 3 minutes of your life. And don't forget to subscribe to the Cardiac Hub, where knowledge meets action, and where every video brings you closer to understanding the heart that keeps you alive.